Antidepressants are a lifeline for millions of people around the world, offering hope and relief to those struggling with mental health challenges. These medications help manage symptoms of depression, anxiety, and PTSD, making daily life more manageable and restoring a sense of normalcy for many. In the United States alone, more than 11% of adults rely on antidepressants, especially a class called SSRIs. These drugs work by boosting serotonin levels in the brain, which helps regulate mood and emotions. But there's a hidden cost that often goes unspoken: sexual side effects, which can impact up to 80% of users, regardless of age or gender. These issues, such as reduced libido, trouble with arousal, and difficulty achieving orgasm, can put a strain on romantic relationships, create feelings of isolation, and add to emotional distress. For some individuals, the side effects become so overwhelming that they consider stopping their medication altogether, even if it means risking a return of their depression or anxiety symptoms. Right now, doctors have no reliable way to predict who will experience these problems, making every new prescription a bit of a gamble for both patient and provider. But imagine if a simple brain test could identify those at risk for these side effects before treatment even begins, changing the way we approach mental health care. Enter the LDEP test, a quick, non-invasive EEG procedure that measures how the brain's auditory cortex responds to sound stimuli. This test indirectly gauges serotonin activity. A lower LDEP means higher serotonin, and vice versa. Since SSRIs increase serotonin, those with already high levels may be more prone to sexual side effects. The LDAEP test could identify these individuals before they start medication. Unlike expensive invasive PT scans, the LDAEP test is affordable and uses common hospital equipment. It offers a practical way to personalize antidepressant treatment. By predicting who's at risk, doctors could avoid prescribing SSRIs to those most vulnerable to side effects. This could truly transform how we approach depression treatment. Researchers in Denmark recently tested the LDAEP's predictive power in a carefully designed study of 90 people with depression. Before starting SSRIs, all participants took the LDAEP test and completed detailed sexual function surveys to establish a baseline. After 8 weeks on escitalopram, results showed that a low LDAEP score predicted orgasmic dysfunction with an impressive 87% accuracy. The test wasn't as strong at predicting reduced libido, but the link to orgasmic issues was clear and significant. Importantly, baseline sexual function didn't affect results, confirming the medication, not pre-existing issues, caused the dysfunction. While these findings are still preliminary, they suggest a future where treatment can be tailored to minimize unwanted side effects. We may soon move from trial and error to true precision psychiatry, improving care for many. Today, managing sexual side effects from antidepressants is mostly reactive. Patients and doctors often have to wait and see if problems develop, then switch medications, or add drugs like Viagra to address the issues after they arise. This process can be frustrating and slow, sometimes taking weeks or even months, and often involves multiple medication changes before finding any real relief or improvement. The LDAEP test could transform this experience, making treatment proactive instead of reactive. With this tool, doctors could select the right medication for each patient from the very beginning, based on their unique brain chemistry. For example, someone with a low LDAEP score might be started on bupropion rather than an SSRI, helping them avoid sexual dysfunction altogether and improving their overall treatment experience. This shift would spare patients unnecessary distress, reduce trial and error, and speed up their recovery, allowing them to focus on healing rather than coping with side effects. There's also a rare but serious risk: post-SSRI sexual dysfunction, where symptoms can persist even after stopping the medication, sometimes for months or longer. While the LDAEP test can't predict this rare outcome, reducing initial side effects may help lower the risk and give patients more confidence in their treatment plan. The promise is a future where mental health care is more personalized, and quality of life and emotional well-being truly go hand in hand. The Copenhagen study is promising, offering new hope for patients struggling with depression and medication side effects. However, before the LDAEP test can become a standard tool in clinics, much larger and more comprehensive trials are needed to confirm its effectiveness and safety. A bigger, international study is already underway, aiming to confirm these early results in a much more diverse group of patients from different backgrounds and age groups. If these trials are successful, the LDAEP test could help doctors personalize depression treatment, moving beyond the current trial and error approach and reducing unnecessary suffering. For now, patients who experience sexual side effects from antidepressants should talk openly with their doctors about their symptoms. Never stop medication abruptly, as this can be dangerous. There are options available today, such as adjusting the dose, switching to a different medication, or adding supportive therapies to help manage side effects. This research offers real hope for a future where depression treatment is not only effective, but also compassionate and tailored to each individual's needs. By understanding each person's unique brain chemistry, we can aim for treatments that heal the mind without sacrificing important aspects of life, like intimacy and connection. The path to truly personalized care is clearer than ever, promising better outcomes and brighter futures for all patients living with depression.